Hi guys, my name is Dr. Kofi Kawasanti and I'm a specialist obstetrician and gynecologist. And did you know that April is Caesarean Section Awareness Month? So I am here to take you through the layers that we operate through when we are performing a C-section. So the first layer that we operate through is the skin. So we make a surgical incision that is on the lower part of the abdomen and also low enough so that it can afford you the ability to wear a bikini even after the cesarean section. The next thing that we'll go through would be the fat. So once the fat is then dissected through, the next layer that we then expose to is the fascia. The fascia is basically the part of the tissue that basically holds the muscle together. So once we dissect through the fascia, it will then give us direct access to the muscle. We always pay careful attention to not cut through muscle, but rather to pull it apart so that it does promote quicker healing thereafter. So once the muscle has been dissected through, the next layer that we get through is the peritoneum, which is a thin sheet that covers the abdomen and also keeps all the intra-abdominal organs in the abdomen. And once this is dissected through, we get to the two important organs, which is the uterus and the bladder. So the bladder usually lies anterior to the uterus. So we usually take careful attention to reflect the bladder away from the uterus so that we have direct access to the uterus. And then we're able to make a lower uterine incision, which would then grant us access into what we call the amniotic sac. So the amniotic sac is basically the sac within which the baby lies. So as soon as the amniotic sac is ruptured, we are able to then get amniotic fluid coming out. Then we basically get to the baby and we're able to deliver the baby without any incidents. Thereafter, we suture all the layers back and then we are essentially done with the C-section. So if you ever thought that a C-section was the easy way out, think again, because as you can see, there are a lot of layers that we have to go through just to get to the baby.